guys, I'm Dr. Ranu, board certified dermatologist. Today I'll be telling you how I treat melasma, both for myself as well as for my patients. Now, you know there's two ways of treating melasma. One is the skincare medical way, and the other one is the aesthetic way. I believe in combining the two, but today I'll just delve into the medical or the skincare part that I advocate. The first is you got to know that the gold standard for melasma still is 4% hydroquinone that can be titrated upwards by your dermatologist. So you need a prescription level hydroquinone of 4% or more. And you have to cycle your hydroquinone, because if you use it continuously, you'll develop a tolerance towards it, or you'll develop long-term side effects. Now, when you're not on hydroquinone, then you start this treatment, nighttime treatment, with actives like, firstly, exfoliating with acid masks at night. I usually use lactic acid and glycolic acid. Next is prescription level azelaic acid at 15%, because 10% over-the-counter azelaic acid does not work on melasma. Next up, at nights when you're not exfoliating, use a prescription level tretinoin, which is the most potent form of vitamin A, or not like retinol is the lowest and tretinoin is the highest. So you need a prescription from your dermatologist again. Okay, so next is follow up your tretinoin with a brightening serum that contains kojic acid, arbutin, licorice extract, and niacinamide. Finally, you seal it off with a moisturizer that contains peptides and ceramides to plump up and moisturize your skin. One thing that I'd like to highlight is very few people know that heat has an equal part to play in worsening melasma, because heat can stimulate your melanocytes and produce melanin. So people who are cooking all day and getting steam in the kitchen from cooking, or going to saunas, or going to having steam baths, bear in mind that that is worsening your melasma. So if you have melasma, try to minimize your exposure to heat. That's all I have time for, guys. See you next week.